So the case I would like to discuss is a 68-year-old man who was diagnosed with Parkinson's disease about 5 years ago, of gradual onset, typical features of tremors, slowness of movement, and responsive to medication. When he was diagnosed, he was started on a regimen of carbidopa, levodopa, and entacapone was included. So this was a triple combination medication, and it currently has been taken at 4-hour intervals throughout the day. In addition, at some point in the past, ropinirole extended release, 8 milligrams was started per day. So this was his regimen for the past 5 or more years. And his story is that he works in sales, and at his current occupation, he mentions that he experiences motor fluctuations during the day. For example, over a 15-minute period of time, he can transition from being in a good state of mobility and dexterity to a situation at which he can't bring his customer products from a display case. This is what his work is, and these episodes occur 2 or 3 times per day, despite taking his medication regularly at the 4-hour intervals and trying to keep medication apart from meals. In addition to having very slowed movements at such times of being relatively off, his voice can become soft and indistinct. And these episodes of being off can last for periods of time up to 30 minutes or longer before the next oral dose of levodopa goes to work for him. So he's a typical story of motor fluctuations on a dose-by-dose basis with good response to the medication when it's working, but levodopa is leaving his system, so it would seem, for periods of time on every day. His treatment regimen has been changed recently, and it includes apomorphine injections, in his case, 0.3 mLs of a solution that's given subcutaneously, which was worked out by titration. He continues to take a medication to block side effects. This is trimethobenzamide, and he takes it each morning in advance of any possible use of apomorphine injections because it has prevented nausea and vomiting immediately after the first injection in the past. And by using this, he's avoided this problem. In thinking about this case, this is a very typical patient in my clinic and probably yours. Patients who've been taking carbidopa, levodopa for more than 3 years often develop motor fluctuations of a regular dose-by-dose wearing off basis. And this patient group is approximately 50% after 3 or more years, as prospective studies have shown. Patients who have good responses to levodopa are very frustrated by this because it's a medication that can do so well for them, of course, and it is a medication that has a very short half-life in their body. It's cleared rapidly, it's poorly absorbed. It's quite understandable why patients experience motor fluctuations because, unfortunately, the absorption through the upper GI tract is somewhat irregular and capricious, especially if meals are interfering with the uptake. But even without food in the stomach, it's been well understood from pharmacokinetic analysis that this medication is just not well absorbed on a regular basis. And taking a dopaminergic agonist like ropinirole, a standard dose of 8 milligrams per day is taken in this case, and it could even be a higher dose, nonetheless doesn't solve the motor fluctuation problem, nor does entacapone mixed in with a carbidopa levodopa. So we have the situation of a patient with frustrations, with job-related problems because he can't count on maintaining consistency of effect throughout the 8 hours of his working day. And these problems can even lead to stumbling with gait, possibly problems of his speech and work, as well as in social situations. And overall, it's a very frustrating situation. When you add up to the total daily off time, he may have as many as 3 to 6 hours per day where he regards himself as not optimally controlled despite taking 2 medications for Parkinson's. Fortunately, he's come across an option for somewhat of a rescue therapy. Apomorphine injected subcutaneously can go to work sometimes within 5 to 10 minutes. It does so in a reliable fashion. And although he has had side effects with this drug, this on-demand therapy has a minimum of problems now because he's using an anti-nausea medication taken each morning to provide some coverage against this. Not every patient needs this kind of protection against side effects, but in his case, it seems to be working.